We're back with notes from No More Hygiene. Steve Anderson here with Dr. Tommy Neighbors. And one of the most overlooked pieces of information in a dental practice is the health history. And I know everybody glances at it, takes a snapshot to see if there's any glaring things, including medications. And from what I understand, Dr. Neighbors, there may be some medications that are in the patient's favor as it has to do with periodontal disease. And it may be to my benefit to have heartburn.
Well, in terms of how it might affect the gum tissue, if you're taking particular medications for that. And I really found it interesting because it's a common periodical, U.S. News and World Report is where this was found. And it comes from research, again, done from the University of Buffalo, like we've mentioned in one of the past episodes of Notes from No More Hygiene. So it's interesting because it's popular press and it's popular medications. These are over-the-counter medications, Nexium and Prilosec. Both of those common OTC medications for heartburn. And they're really showing the effect of how those medications alter what we term the gut microbiome. That's a popular scientific term right now as it turns into gut health, stomach health. And, we tend to forget that the mouth is connected to that tract. The mouth isn't just this box. It's not connected to anything. It's, in fact, the beginning part of our digestive system. And so having medications that can alter that chemistry, especially something as common as Prilosec, and now being picked up with popular press and research on what it's doing for periodontal disease, it's just interesting.
So it actually stimulates and helps the gut biome, those two medications.
Right, absolutely. And of course, when you get into literature like this, it does come from the University of Buffalo. It's also comes from, they quote the American Academy of Periodontology, so it does come from scientific literature, but they're not saying that these medications stop periodontal disease. But what they are saying is that patients that are continually on these medications to help alter the chemistry there do have lower probing depths as based on people that have heartburn, let's say, and are not taking these medications. So the study was basically a blind study for the patient on who was not taking these and who was. And then they went through the whole series of measuring pocket depths and gingival health. And it's pretty significant that the difference between the patients that were on these medications, they have a term for them here. They are called PPIs, which is, I'll look that up. It's a class of drug that's widely prescribed to treat heartburn, acid reflux, and ulcers, and they're called protein pump inhibitors. I know it sounds, softer when we say Prilosec, but
right.
It's called protein pump inhibitor, and that's a class of medications that they're doing some research on right now.
So if your patients have heartburn and are on Prilosec or Nexium, there may be some benefits to their periodontal health. So one more thing to take a look at when you're viewing their health history that might be in their benefit, or if they do have heartburn, those medications might be a benefit to them. Who would have guessed?
Absolutely. It's just another tie-in, to say that heart health, body health, periodontal health, it's all connected. And for us to think that the digestive system is just our stomach, or our intestine, it really starts in the oral cavity, and altering the chemistry in the stomach is literally altering the chemistry in the mouth. And it's just another way to kind of think of your mouth as a part of the body and a part of this whole system called the digestive tract.
Love it. Thanks for sharing, Dr. Neighbors. That's just one more note from No More Hygiene. We'll see you next time.
Sounds good.